Hello, good morning everyone. I'm Wesley here. Today I would like to present my master research, which is supervised by Professor Batnya Dr. Sulyadi Sufahani on the topic of menu planning with new hybrid binary mathematical modeling with new optimal sensitivity analysis algorithm for autism primary school children in Malaysia. So here is the overview of my presentation today. Let's start with the introduction. Well, let's talk a little about autism spectrum disorder, ASD. It refers to the biological disorder not just impacting on the social interaction of children. They also affect on the misinterpretation of feelings, fear, and abnormal behavior. However, among the various challenges faced by ASD children, feeding problems can be seen reported as high as 90% among them, which includes food selectivity, resistance to trying new foods, and ritualistic eating habits. Well, ASD is the challenge faced globally. Surprisingly, Malaysia is ranked at top 50 in global for the population that diagnosed with ASD. So the number of children who diagnosed with ASD in Malaysia has increased to 589 children in year 2022, which is about 5 times folds of increment from the year 2010 in just 12 years period of time. So as we can see, today in 2024, the average household salary in Malaysia is reported as around 76k per annum, while the average spend on an ASD children in yearly is around 35k, which includes their medical costs, special education, daily necessities, nurseries, and food. So it would be a challenge for a family to maintain their family lifestyle while having a children diagnosed with ASD in Malaysia. So in order to lower down the financial burden of a family, especially if they have ASD children, so here is my problem statement on my research. First, how to prepare a balanced food menu for autism children with the lowest cost. Second, how to prepare menu to meet certain nutritional requirements for autism children and to get it with the lowest cost. Despite on the increasing number of ASD children in Malaysia, there's still no research conducting optimization approach in solving the diet problem for autism children. Now, here's the objectives of my research. First, to create menus that is specifically designed to fulfill the dietary requirements of children with ASD while minimizing the cost. Second, to create a new algorithm and mathematical model to help children with autism to prepare meals for a week while keeping the cost minimal and serving the appropriate amount of food for their growth. Alright, so here is the literature review on my research. The optimization of the menu planning started back in 1945, which is actually by Stingler. He's using the trial and error approach, to create the least cost menu for American Army, while achieving, of course, the nutritional value for the Army to be fit. So in year 2003, Fourier, Gay, and Currington used linear programming to achieve a week of fixed nutritional requirements menus, which is at the cheapest package with the combination of food. However, they could not fulfill all the constraints at that time to lead to an optimization solution at that time. So in year 2014, Suryadi Sufahani, which my supervisors, and Zuhaimi Ismail, used integral programming in menu planning for secondary school children in Malaysia, while hitting their nutritional intakes and also minimizing their costs. In year 2020, the research by Daria Ashok Okay, use linear programming as well to build an optimization model in the creation of a new menu in their restaurant, which is in Ukraine. Okay, they serve Ukrainian and Georgian cuisine. So at that time, it was used to build a new menu for their targeted customer, which is a male customer aged between 19 to 24. They achieved, okay, they achieved to lower down the cost of the menu by 20% without sacrificing the nutritional and energy value for their targeted customer, okay, with linear programming. So the methodology of my research is categorized into three parts, which is data collection, data modeling, verification, and results. Primary and secondary data is collected throughout interviews, research, books, and journals for the nutrients requirement for primary school children between 7 to 12 years old. Linear programming and integer programming is used to develop the model to produce the meal that meets the nutritional requirement with the lowest cost. A small number of samples will be taken from each food groups to validate the models and results. So qualitative methods and quantitative methods are used in data collection. For primary data will be collected through interviews with JED Autism Athletics and Sunnybank Hill Special Needs Schools to verify on the RNI for normal children and ASD children, and the nutrients that should be required or should be avoided by the ASD children as well. Secondary data is obtained from books, journals, and reports, while the food items involved in the studies are from the nutrients composition of Malaysia foods, which are all the foods recipes in Malaysia. So on the left is the JED Autism Athletics Training Center, which they are specialized to train sports for ASD children. So we meet their founder, Joel, which is in the middle. Sunnybank Hill Special Needs Schools are engaging a meetup with us. They are an educational hub for special kids. They have their own school chef, nurse, and dietitians. So from Sunnybank Hill as well, they did mention in their email the essential nutrients for ASD children are omega-3 acids, vitamin B, vitamin 12, zinc, magnesium, and fiber. And we need to make the meal appealing by rotating the menus while maintaining the familiarity for the children of their food. So this is the challenge that they mentioned. Okay, so here are the 10 category of food, which is found in the Book of Nutrient Composition of Malaysian Food books, with a total of 426 recipes. Okay, so we have 10 category: beverages, cereal flour base, rice flour base, cereal meal base, meat, vegetables, fruits, wheat flour base, seafood, and miscellaneous recipes. Wow, a total of 6 meals will be prepared for a day for children with a total of 18 dishes. While serving the variety of menu from breakfast to supper, Malaysians usually would prefer to have at least 2 glasses of water and 1 rice to be served as part of their meal each day. The cost of the menu for a day is aimed to be below 15 ringgit as per the government support of 2 ringgit and 50 cents for a meal in primary school canteen. This would act as the constraint of the food group's requirements in our model later. All right. So for example, we can see on the right hand side, like breakfast, we have a combination of beverages and a cereal flour based recipe. For the morning tea, we will serve beverage with rice flour based recipe, and so on for lunch, evening tea, dinner, and supper, with a total of 18 menu being served. Okay. Well, these are the kind of food that ASD children should avoid based on the secondary source of data, which is the books, journals, and the past research. So after verification with the nutritionist, the recipes which includes high content of sugars will be excluded for the menu, as well as it has a higher impact in health for ASD children. And the nutritionist is advised the children not to take any food that contains high sugars. So here will be the nutrients constraints in our optimization models. We have energy, fats, proteins, riboflavin, thiamine, niacin, calcium, ascorbic acid, iron, and Re. So these are the secondary data source involved in the study from the RNI 2017 and Malaysian Dietary Guidelines. So these are the energy requirements for the age group of 7 to 12 and boys and girls. So these are the nutrients that involved in our study, and this would be act as the constraint as well on the nutritional requirement for the ASD children. Well, in our study, it combines decision making with adaptability, which a hybrid of mathematical modeling is used to obtain the least cost menu with nutritional balance, while sensitive analysis allow us to have the flexibility of changes in the menu by preferences. So this would be the general equation of the model on the cost minimization in the menu based on the cost of food in year 2024. The number of meals per day, the food groups involved would act as the constraint in our model. So this is the constraint of the nutritional requirement of children from 7 to 12 years old. It is given a range of boundaries in the RNI book of 2017. And this would be acting as the constraint of the food group requirements of the 18 dishes per day. We will include 2 glasses of water to be in our daily meal, and 1 plain rice as well to be included in our daily meal, which is kind of Malaysian preferences eating habit. All right, so this is how the model works using linear programming and integer programming. So a list of 18 dishes will be chosen from the model at the end, and the dishes will be allocated to each meal session according to the preferences. So a small data will be run for a day of the menu. After validation and verification be done, a big data will be run for a 1-day menu, and after that, a 7-day menu plan will be built from the validated model. So the model will be validated with several iterations by increasing the number of type of dishes. So if the result did not differ significantly, the proposed method is good to be used for further investigation and to build a 7-day menu plan. So all the menu that is being built is not going to repeat. Okay, so we are giving the variety of food for the children with ASD. So the novelty of my research here, previous study has just focusing on a targeted age group, which is only menu planning in optimization. Well, this study considers the emerging problem of Malaysia having higher ASD children. So the model will be based on the cost of food as of year 2024. So in the end of the research, a mathematical model and a new algorithm for autism children in weekly meal preparation will be developed. So the solution is customized with Malaysian meal preferences and specifically children with ASD, which is covering the child age of 7 to 12, which is the most important stage of a healthy growth of a future adult in that period. So in our research, the solution is definitely customized for Malaysian and children with ASD, and the menu is tailored to meet specific nutritional needs while adhering to cost constraint for the children of 7 to 12. So these are the expected results of my study. So with linear programming and integer programming, it can be used to prepare menu to meet the nutritional requirements and cost constraints for autism children. Second, to establish a mathematical modeling as the optimal solution of diet problem for autism children. And third, to develop a decision support system based on the proposed mathematical model. With the algorithm on a 7-day menu plan, we are able to develop a mathematical modeling with and a new algorithm for autism children without repeating the food to keep the variety and freshness for ASD children. And the third one, through interview and secondary data, we are able to determine the balanced nutrients that required by the autism children, including the food that they should avoid or the food and vitamins that is essential for. And here is the grand chart of my research. And these are the reference that is included in my research. And that's all for my presentation today. Thank you very much for hearing from me. And I hope this research can benefit Malaysian, and especially for the children and the parents. This study contributes to the emerging problem in Malaysia. Thank you for hearing from me. And this is my presentation for today. Thank you.